For women using hormonal contraceptives, progesterone-only options have traditionally been favoured for a lower risk of breast cancer. But a new Oxford University study has revealed any of the available options can increase a woman's risk of developing the disease. Joining us now with more analysis on this study is the medical oncologist, Professor Fran Boyle. She specialises in breast cancer. Fran, we really appreciate your time. Thank you for joining us. Anyone seeing this story who is on the pill or has a loved one on the pill might be feeling a bit alarmed at these results of this study. Should they be?
Well, thanks, Ashley. And for anyone receiving oral contraceptives, it's important to think about the risks and also to regularly update yourself about whether the information is changing. So what this study showed was that women having progesterone-containing hormonal contraceptives, including the progesterone-containing IUD, had a significant but actually very small rise in breast cancer risk. This was mostly limited to women who were in the older age groups, so in their 30s, and I think women who are very young, so in their 20s and even younger, the increase in breast cancer risk was trivial, and I don't think that age group really needs to be concerned. But for older women, once you've finished your family, it's probably better to think about other sources of hormonal or other sources of contraception other than hormones.
So when you say there's a small increase in the risk, what are we talking here? How much increased risk are we looking at when it comes to what this study suggests anyway?
Well, in that youngest age group, the difference was 8 in 100,000 women up to 9 in 100,000 women. So one extra person, that's never good, but it's tiny. Once you get up into the later 30s, you're talking about 200 people in 100,000 and 260 who, if they're users, might get breast cancer. So as you go up into the breast cancer prone age groups, this is where we start to see the risk become something more relevant for women to consider and to perhaps then move on to other types of contraception. Vasectomy for men, tying of tubes for women, for instance, have no increase in breast cancer risk, which is great, and might be suitable for those who finish their families.
And so, Professor, does the risk drop again once someone stops taking the pill, or is the damage sort of already done for someone who has been on the pill for 20 or 30 years by that point?
You're right, Ashley. Very importantly, the risk drops quite quickly after you stop taking the pill. And in this study, the women who were diagnosed with breast cancer were usually within about 3 years of taking the pill or current users, and that risk drops certainly within 5 years. So getting back on track is important as a consequence of stopping medication.
Fran, are we actually more broadly seeing rates of breast cancer in younger women increasing, or is it just that we're perhaps getting better at diagnosing those cases earlier?
I think we are seeing a rise in breast cancer rates right across the board, Ashley, and so that, of course, will affect younger women too. In that younger age group, genetic factors are important, particularly inherited genes that increase the risk of breast cancer. And so if a younger woman has a family history of breast or ovarian cancer, we'd really encourage them to speak to your doctor and make sure you're getting the right advice about screening and genetic testing if that's appropriate. We're also seeing women delaying their childbearing, and we know that that has an increased risk of breast cancer. Now, we're not going to ask our 18-year-old daughters to go out and get pregnant just to reduce their risk of breast cancer. That would be nuts. And, of course, women's reproductive choices are respected by all of the medical fraternity. But there is a bit of a wake-up call that if you are delaying your childbearing into your 40s, you're starting to get up into the breast cancer age group, and pregnancy at that time may also increase your risk. So there's quite a few factors at play. Interestingly, also in this study, they matched women with control, women who weren't taking oral contraceptives, but they matched them for the same number of children, the age at which they had their children, and interestingly also alcohol intake, which we know is a risk factor. And that also might be at play in younger women.
Give us some good news, Professor. Are we getting better, though, at treating breast cancer when it happens? How significant have we seen the improvement in survival rates in recent years?
Well, that's absolutely good news, Ashley. Survival rates for women diagnosed with early breast cancer are up into the 90% at 5 years these days, and 10-year survivals, of course, with new treatments are also going to be higher. Women diagnosed with metastatic breast cancer that's already spread elsewhere, we are also making significant progress with, and that's particularly for two types of breast cancer: hormonal breast cancer and HER2-positive breast cancer. We have lots of new drugs that work much better and are better tolerated. There is a small group of women with metastatic breast cancer whose prognosis is not so good. That's called triple-negative breast cancer. And we're on the verge of breakthroughs being available to women in that area as well. So I'm hoping that in the next 5 years, we're going to see those new treatments make their way through to the clinic, become affordable when they move on to the PBS, and also make a difference for that little group of women who've been a little bit left behind, unfortunately, until now.
We would all like to see that. Professor Fran Boyle, really appreciate you joining us to break down that study a bit further. Thanks so much for your time.
Thanks, Ashley. I think the message is don't panic, but make sure you're talking to your GP about all of the things that might influence your breast cancer risk, because that's quite individual.